Do you know what chronic kidney disease is and how it affects your health? Let's spend a few minutes understanding this important health condition. Chronic kidney disease, often referred to as CKD, is a condition characterized by a gradual loss of kidney function over time. It's not an overnight thing, but rather a slow process that may take months or even years before it manifests itself. Now, to grasp the impact of CKD, we need to understand the role our kidneys play in our body. These two bean-shaped organs, each about the size of your fist, hold a vital responsibility in maintaining our health. Situated just below the rib cage on either side of your spine, the kidneys are our body's sophisticated waste management system. Each day, our kidneys about 120 to 150 quarts of blood to produce about 1 to 2 quarts of urine. This includes waste and excess fluids. That's a lot of filtering, isn't it? Just before we delve further into the implications of CKD, we want to remind you to hit the subscribe button to our YouTube channel. Keeping up with our informative videos will equip you with useful knowledge on important health topics like this. Now, back to CKD. When we talk about chronic kidney disease, we're talking about a condition where the kidneys are unable to perform these essential functions effectively. Over time, the waste and excess fluids that should have been excreted can build up in your body. This can lead to other health complications, including high blood pressure, anemia, weak bones, poor nutritional health, and nerve damage. CKD is often silent in its early stages, meaning it can progress without any noticeable symptoms. But as the disease advances and the kidney function decreases, symptoms like fatigue, trouble sleeping, decreased appetite, and muscle cramping may set. Now that we know what CKD is, let's delve into the risk factors and symptoms. What makes someone more likely to develop CKD, and what are the warning signs to look out for? Chronic kidney disease, often abbreviated to CKD, is a condition that affects your kidney's ability to filter waste and excess fluids from your blood. This damage can happen over time, and certain factors can increase your risk of developing this disease. One of the most common risk factors is diabetes. When you have high blood sugar levels, it can cause damage to the blood vessels in your kidneys. Over time, this can lead to CKD. Hypertension or high blood pressure is another common risk factor. Like diabetes, high blood pressure can damage your kidneys over time. Another factor to consider is your family history. If you have a family member who has had kidney disease, you may be more likely to develop it yourself. It's important to be aware of your family's medical history and discuss any concerns with your doctor. Now let's talk about the symptoms of CKD. One of the tricky things about this disease is that symptoms often don't appear until the condition has advanced. You may not notice any changes until your kidney function is significantly impaired. However, some symptoms to look out for include nausea, fatigue, and sleep problems. You may also notice changes in your urine output. For instance, you might find that you're urinating more often or less often than usual. Or your urine might be foamy or contain blood. Another symptom of CKD is a loss of appetite. You might also experience muscle cramps, especially in the legs. Swelling in the ankles and puffiness around the eyes can be another sign that your kidneys aren't functioning as they should. Remember, these symptoms can also be caused by other conditions, so it's important to talk to your doctor if you're experiencing any of these issues. They can help determine whether it's CKD or another condition that's causing your symptoms. Understanding the risk factors and symptoms can lead to early detection. But how do doctors diagnose and stage CKD? How do medical professionals determine if someone has CKD and how severe it is? Well, there are a few diagnostic tests commonly used to detect and assess chronic kidney disease. Firstly, there are blood tests. These look for the level of waste products such as creatinine and urea. High levels could indicate that the kidneys aren't functioning as they should be. Then, there are urine tests. These help to identify abnormalities that point towards CKD. For instance, the presence of proteins or blood in the urine could be a telltale sign of kidney damage. In some cases, imaging tests like ultrasounds or CT scans may be used. These can provide a visual check for physical abnormalities in the kidneys, such as cysts or kidney stones. But diagnosing CKD is only part of the story. It's also important to determine the stage of the disease, as this can greatly influence the treatment plan. Chronic kidney disease is classified into 5 stages based on the kidney's ability to do their job, that is, to filter out waste and extra fluids from your body. Stage 1 is the mildest form. This stage is characterized by normal kidney function but with signs of kidney damage. Stage 2 involves a mild loss of kidney function. Stage 3 involves a moderate loss of kidney function. Stage 4 involves a severe loss of kidney function. Stage 5, also known as kidney failure or end-stage renal disease, is when the kidneys have lost nearly all their ability to do their job effectively. Each stage requires a different approach in terms of management and treatment, which is why it's so important to identify this early on. Diagnosis and understanding the stage of CKD is crucial in determining the right treatment. So, what are the treatment options available? Let's dive into that next. Once diagnosed with CKD, what are the steps to manage the disease and maintain a good quality of life? This question is often at the forefront of those grappling with a chronic kidney disease diagnosis. The answer lies in a multifaceted approach that includes both medical treatment and lifestyle changes. Starting with medical treatment, the primary goal is to slow down the progression of the disease and manage symptoms. This usually involves medication to control high blood pressure, as hypertension is a common factor that exacerbates kidney damage. Diabetes is another condition that often goes hand in hand with CKD, so managing blood sugar levels is also crucial. In addition to these, medications may be prescribed to manage other complications of CKD, such as anemia, bone health issues, and elevated cholesterol levels. It's important to remember that each person's treatment plan is unique and tailored to their specific needs, so open communication with healthcare providers is key. But treatment doesn't stop at medication. Dietary changes also play a significant role in managing CKD. A healthy diet can help maintain kidney function and overall health. This might involve limiting certain nutrients such as sodium and protein, which can strain the kidneys. It's also recommended to limit the intake of potassium and phosphorus, as high levels can lead to complications. However, this doesn't mean that you have to sacrifice taste and enjoyment when it comes to food. There are plenty of kidney-friendly recipes out there that are both delicious and nutritious. Consulting with a dietitian who specializes in kidney health can be an invaluable resource in navigating these dietary changes. Lifestyle modifications also make up a vital part of CKD management. Regular exercise, even light activities like walking or gardening, can help improve overall health and well-being. It's also important to quit smoking, as it can speed up the progression of kidney disease. Similarly, limiting alcohol intake can help protect your kidneys. Lastly, but certainly not least, is the importance of regular follow-ups with healthcare providers. This allows for the monitoring of kidney function and the adjustment of treatment plans as necessary. It's also an opportunity to discuss any concerns or questions about living with CKD. Living with CKD can be challenging, but it's important to remember that you're not alone. Support groups, both in person and online, can offer a sense of community and a space to share experiences and advice. It's also worth noting that advances in medical research are continually improving the outcomes and quality of life for those with CKD, so while it may be a chronic condition, it's not a static one. Managing CKD involves a combination of medical treatment and lifestyle changes. It's about taking control of your health. Remember, you are an active participant in your care, and your actions can significantly influence the progression of the disease. Let's revisit the important points we've covered about chronic kidney disease. We've explored what this condition is, a long-term disease that affects the kidneys, impairing their function over time. We've identified the risk factors and symptoms, including diabetes, high blood pressure, and a family history of kidney disease. Symptoms can range from fatigue and decreased appetite to more severe signs like swelling and changes in urine output. We've also delved into the crucial stages of diagnosis, from stage 1, where damage is minimal, to stage 5, known as end-stage renal disease. Remember, early detection can significantly improve the prognosis. Finally, we've looked at the different treatments and management strategies. These can include lifestyle changes, medication, dialysis, and in severe cases, kidney transplantation. Remember, understanding chronic kidney disease is the first step towards effective management. Stay informed and take charge of your health.